Hello, welcome to Study Circle. Today we are going to read Class 7th Standard Civics, Chapter 2, Role of the Government in Health. In a democracy, people expect the government to work for their welfare through the provision of education, health, employment, housing, or the development of road, electricity, etc. What is health? Health means our ability to remain free of illness and injuries. Health is not only about disease, but there are other factors also that affect our health. For example, clean drinking water or a pollution free environment also helps people to remain healthy. Healthcare in India. Paradox of healthcare in India. There are positive and negative both aspects are healthcare in India. Positive aspects. It has the largest number of medical colleges in the world and is among the largest producer of doctors. Approximately more than 30,000 new doctors qualify every year. Healthcare facilities have grown substantially over the years. In 1950, there were only 2,770 government hospitals in India, and in 2017, the number grew to 23,583. There is a great scope of huge medical tourism. India is the third largest producer of medicines in the world and is also a large exporter of medicine. The negative aspects of healthcare in India is that more doctors are settling in urban areas. People in rural areas have to travel long distances to reach a doctor. The number of doctors with respect to the population is much less in rural areas. Low reduction in patient. Every year about 5 lakh people die from TB, that is tuberculosis, and this number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number is not decreasing. Low availability of clean drinking water. 21% of all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, etc. Half of all children in India do not get adequate food to eat and are undernourished. Requirements to prevent and treat illness. Appropriate healthcare facilities. To provide required care and services to patients, for example, health centers, hospitals, laboratories for testing, ambulance services, blood bank, etc. Adequate healthcare workers. In order to run healthcare facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illness. Need of medicine and equipments for treating patients. Division of healthcare facilities, public health services, and private health facilities. Public health services. It is a chain of health centers and hospitals run by the government which are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illness to special services. At village level, there are health centers where there is usually nurse and a village health worker. They are trained in dealing with common illness and work under supervision of doctors at the primary health centers, that is called PSC. Such as center covers many villages in rural area. At the district level, there is a district hospital that supervises all the health center in the district. Need of public health service. Constitutional mandate. It is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right to life of every person. Common service. The resources need to run these services are obtained from the money that the public pay to the government as taxes. Access to the treatment for poor. It is meant to provide quality healthcare services either free or at low cost. Private health facilities. They are not owned or controlled by the government. There is wide range of private health facilities such as registered medical practitioners RMPs in rural areas. Private clinics run by large number of doctors etc. Urban areas also have a large number of doctors. Privately owned hospitals and nursing homes, private laboratories, etc. Healthcare and equality. Is adequate healthcare available to all? Issues in healthcare facilities in India. Firstly, expensive private sector. If public services are not increasing as per requirement, then there will be a situation where there is only one option of private services to poor. Secondly, encouragement of incorrect practices in private sector. At times, inexpensive alternatives though available may not be used. For example, some medical practitioners are found to prescribe superfluous medicines injection when simple medication may suffice. In fact, barely 20% of the population can afford all the medicine that they require during an illness. It was reported in a study that 40% of the people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possession to pay the expenses. Patriarchal concerns. Women's health concerns are considered to be less important than the health of men in the family. Inadequate health centers. Many tribal areas have very few health centers and they do not run properly. Way forward. It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. Health is much dependent on basic amenities and social condition of the people. As it is on healthcare services, it is important to work on both in order to improve the health situation of our people, and this can be done. For example, the Kerala experience. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. This helped villages to make sure that proper planning was done for water, food, women's development, and education. Improved situation. This meant that water supply scheme was checked, the working of school and anganwadis was ensured, and specific problem of the village were taken up. Health centers were also improved. As basic amenities improved, health conditions also improved. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in Central America. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped to spend that money on health, education, and other basic needs of the people. The Costa Rican government provides basic services and amenities to all Costa Ricans. Interesting point of this chapter is that the Medical Council of India's Code of Ethical states every physician should, as far as possible, prescribe drugs with generic names, and he or she shall ensure that there is a rational prescription and use of drugs. Thank you.